Hi everyone, my name is Dr. Mike Gorman. I wanted to talk today a little bit about chronic knee pain. We see over the years a lot of different injuries, a lot of different things throughout our practice. My original background was in sports medicine, working at Villanova, working in a physical therapy clinic. Then we got into chiropractic, but as we studied over the years, the last 20 years, more and more evolved techniques. The more that you know, the more questions you know to ask, and the more relationships that you're aware of. So, for example, this video is not about acute knee injuries. Now, if you have an acute knee injury, you could certainly come into our office, and our current patients do all the time, and we can evaluate it and see what we need to go from there. We can do some advanced sports medicine things to get you back a little bit quicker if that's your desire. But what I really want to talk about today are some chronic knee things and some things that you probably wouldn't think of that are some pretty interesting relationships throughout the body. So whenever you've got chronic knee stuff, the first place I go to, and it's not just because I'm a chiropractor, but it happens to be because the nerves and the brain run the show, is the spine, and in particular the low back. If your low back is out of alignment, whether you've got pain or not, doesn't matter. Sometimes we compensate or adapt by twisting our hips just a little bit, enough to pinch that nerve. That nerve coming down to the knee gets pinched. We've all heard of sciatica causing low back pain into the knee, but depending on what part of the nerve is pinched, that can cause knee pain. But a lot of times the nerve doesn't always cause pain. The part of the nerve that affects function is what's involved. So if you've got a nerve that's being pinched, sometimes up to 60% can be pinched before you even have any pain. So those nerves can actually affect the muscles around the knee, and therefore those muscles will malfunction or dysfunction, and they're not going to work as well as they would, so therefore they don't support the knee as well as they would. So if you go out and you do a lot of walking or exercise or play sports or do something to kind of push yourself a little bit, those muscles don't work, the knee's a little bit unstable, causes it to be inflamed, and you get chronic knee pain. They call this any host of things, from tendonitis or bursitis or things like that, right? Anything with an itis just means inflammation. So there's a number of different things in our office that we do to evaluate inflammation. There are things related to allergies and food allergies and what we eat, and a whole host of different things that affect inflammation, chronically at least. So we want to look at that anytime you've got an itis. But with the knee, when it comes to evaluating it, we're also wanting to look at physically the biomechanics. So we look at above, as I was saying, are the hips and the spine in alignment and getting the right signals and nerve messages to the knee. We want to look at the knee itself and the muscles around it. Sometimes we have a muscle imbalance where one side's tighter than the other, and we've got to do some stretching, some exercises, just like physical therapy kinds of rehab types of things. But we also want to look below the knee. Very common that people with flat feet, or they could even have too high of an arch, but more common is pronated feet or flat feet. When they roll in, then that puts abnormal stress on the knee, and as you walk, run, do things, over time that puts all kinds of stress on the knee. If you don't address that, which is part of the root cause, then anything else you do is just dealing with short-term, quick fixes, but it doesn't address the root problem. The other thing I want to mention related to the knee is if you ask 100 acupuncturists, hey, I've got a chronic knee problem with no injury, what's your first thought? Most of them will say, oh, that's textbook classic gallbladder. Now, if you're like me, the first time I heard that when I studied acupuncture, I go, excuse me, gallbladder? What could possibly the gallbladder have to do with the knee? Well, it turns out that in Chinese medicine, the knee, and in particular a muscle in the back called your Popliteus muscle, that which is the main stabilizer of the posterior knee, that muscle relates to the gallbladder. Now I've got 20 years experience now at treating people with these, so now I think it's fun because patients, when they first think, Doc, that's a little crazy, over the years, hundreds of people will come to me and go, Doc, I would have thought you were crazy, but you're absolutely right. Every time I eat a fatty meal and it stresses my gallbladder, wouldn't you know it, for the next day, my knee aches and it hurts. And I say, well, of course, because after you eat that fatty meal or you eat some things that you really shouldn't eat and it stresses your gallbladder, then what ends up happening is that popliteus muscle that relates to the gallbladder is not going to work right. It's going to malfunction, and at least for a day or two till that gallbladder and everything gets digested. So everything in the body is connected, but in particular with the knee, there's a number of different things that we can look at physically, nutritionally, and specifically related to stress. Just to follow up with that, in Chinese medicine, that popliteus muscle and the gallbladder, they relate to resentment. I've had literally 50, 60, 70 people that they're dealing with some resentment in their life and they've got knee pain. When we help them through that, and we do a technique called NeuroEmotional Technique, or NET, which I'm board certified in, to identify where the resentment comes from. As soon as we do and they release that, the knee pain gets dramatically better. So everything in the body is connected, whether you know about it or you believe in it or not. The more that you study, the more that you can have a more thorough understanding of how the body works. There's just a few other things to consider if you've got chronic knee pain and you want to really get it figured out and get to the root cause.